All right, just a heads up for everybody that's on right now. This is being recorded. And today I'd like to just introduce myself and um, Emily Peterson, who is here with us today. I am Micheline White. I'm the Executive Director of Mendonoma Health Alliance. We provide healthcare coordination and other resources in the community that help with prevention, treatment, and recovery of not only substance use disorder, but for chronic conditions like hypertension and diabetes. And today we are here to talk about Narcan and addiction education. And we have the wonderful opportunity of meeting with Emily today, who's going to be presenting. Emily is a doctor of pharmacy and has donated her valuable time in helping us do this presentation. This is our first of many. And so while we go through this process, we will be launching polls that ask questions about general knowledge and some of the information that Emily is presenting. So no pressure at all. It is anonymous. All the polls are anonymous. So as we go through the process, people will probably be joining, and if you could please keep yourself muted, that would be great. So that way there's no background noise in the presentation. So without further ado, Emily, I will turn it over to you and remove my spotlight. There you go.
All right. Let me go ahead and share my video. One second here to get it. Okay. Well, thank you so much for having me today. I am going to be presenting on learning how to save a life, the ins and outs of opioids and overdose. My name is Emily Peterson. I'm a pharmacist, and I'll be presenting this as it's been developed in collaboration with the wonderful Mendonoma Health Alliance. There we go. Okay, so you may be asking, why here, why now? So I wanted to give you a little bit of context about myself and my training. And so I've been practicing in pharmacy for about 16 years. I've worked in multiple different roles throughout this time, from a pharmacy clerk, where I started in my early career in pharmacy, to a pharmacist working in retail and hospital pharmacy in our community. I'm fourth generation in my family to be raised here on the northern Sonoma coastal region. And one of my greatest aspirations or goals in pursuing a career in pharmacy was to be able to become an educator for my community and an advocate for the health of this community that is so near and dear to my heart. Throughout my career in pharmacy, I've encountered many individuals and had hundreds of conversations about prescription opioid medications, their side effects, and potential risks if used inappropriately. Prescription opioids in many cases play an essential role in the treatment of pain, sometimes for an acute type of pain, for example, after a surgery, and sometimes for more chronic conditions in which they're used longer term. I've worked with individuals, who have needed to take medication on an acute basis, who were concerned about potentially becoming an addict. I've worked with individuals requesting help because they felt they were becoming dependent in some way, having taken an opioid prescription. And I've also participated in caring, unfortunately, for patients who have overdosed, and others that have become involved in other illicit substance abuse, who have seen a dramatic decline in their own personal health. So, in summary, the why here, why now. As a pharmacist, I feel compelled and a responsibility to try to help and educate, raise awareness about opioids and the life-saving reversal agent naloxone. I feel I have a responsibility to reduce the stigma associated with not only opioids, but also with the use of Narcan and its accessibility in our community, and to really break down barriers to improve access to treatment and hopefully to help others and teach others how you too can save a life and assist somebody who may be overdosing from opioids. So today our educational objectives will be focusing on understanding the term stigma, defining the terms opioid and Narcan or Naloxone, understanding the causes of an opioid overdose, recognizing the signs of an overdose, understanding how to use intranasal Narcan or Naloxone, learning the critical steps in safely responding to an overdose, and reporting the use of the reversal agent Narcan or Naloxone. It's anonymous, but it's critically important that we understand where it's being used in our communities in order to help with resources. So I'll start a little bit about the opioid epidemic. Most of us have heard that term before, but there's really been, over time, 3 major waves or trends in the rise of opioid overdose deaths. And the first wave really started back in 1999, in which there was a rise in prescription opioid overdose deaths. And it was throughout this time that we saw a steady increase in the number of prescription opioids being prescribed, and in turn, unfortunately, a trend upward in opioid overdose deaths. The wave number 2 really started around 2010, and that's when we started seeing an increase in heroin overdose deaths. Heroin, as we'll talk a little bit more about, is a slightly modified opioid, and its trend upward in our communities started the second wave. The third wave really started around 2013, in which we had a rise in synthetic opioid overdose deaths. And synthetic opioids are medications like fentanyl, sometimes prescribed and sometimes illicitly manufactured. And unfortunately, nowadays, what we hear consistently is fentanyl being used to lace heroin or methamphetamine, cocaine. And so we've really seen an increase in fentanyl-related opioid overdose. On a national level, I wanted to provide a few of the statistics, which are, staggering for sure. Overdoses involving opioids killed nearly 47,000 people in 2018, and 32% of those deaths involved prescription opioids. And in 2019, overdoses involving opioids killed nearly 50,000 people, and over 70% involved in opioid. If we take that into kind of break it down a little bit further, that's about 40 deaths per day from opioid overdose. The opioid deaths since 1999 have increased 6 times. And though we did see a decrease in opioid-related overdoses between 2017 and 2018 that were reported nationally, the impact of the COVID-19 pandemic has led to an increased reports of opioid-related overdose in the most recent year. I think it's important to understand that the opioid epidemic is far-reaching. It impacts communities all around us of varying age, gender, race, education, socioeconomical levels. It really impacts a tremendous number of people around us, and some individuals that we probably don't even realize. Within our community, I also wanted to share a few of the statistics that were gathered via the California Opioid Surveillance and the Melanoma Health Alliance surveys. So in 2016, Point Arena, California had the highest opioid-related overdose death rate per capita in the county and the state. And Gualala, California had the highest opioid-related overdose death rate per capita in the county and state. Gualala also ranked second highest in opioid prescriptions per capita in the state. And when we think about per capita, it really just means that, some individuals have no prescriptions for opioids and other individuals may have several. So when we look at per capita data, we just have to make sure we take that into account. It's estimated that about 12% of the population struggles with addiction, compared to California's state average of 8.5% and compared to 7.2% nationally. And 15.3% of middle schoolers and high schoolers reported taking a prescription medication not prescribed to them. 87% of students surveyed reported parents or teachers seldomly or never talk to them about dangers of substance abuse. And lastly, in Mendocino County, the rate of opioid overdose deaths is 3 times more than the rate for California as a whole. And I think a few really important points about our community in general is that we, specifically in the northern Sonoma and Mendocino County areas, it is much more isolated. There's much more restricted access to resources. And if there was an opioid overdose, the time that it takes for a response in these more rural areas can take a considerable amount of time. And so it's so important that we look at having increased, Narcan and Naloxone in our community and train our communities about how to use it so that we can, too, help our neighbors, friends, family around us should they get into trouble. I'm going to talk a little bit about stigma, and then I'm going to share with you the Overcoming Addiction, the Mendocino Health Alliance video that was put together. And so to introduce the term stigma really is a mark. It's a term that's associated with a mark of disgrace, usually associated with a certain circumstance, quality, or person. And so the reason that stigma is so important that we talk about, and the reason that we really want to break down the stigma around not only opioids, but also Narcan, the terms druggies or drug addicts, or all of those kind of negative connotations that are associated with somebody who may be taking opioids, or who may feel as though if they are taking an opioid that they have a negative stereotype around them. We really need to break those stigmas down in order to improve access to treatment. And so when we have stigmas like this, it creates labels, it creates stereotypes. It creates negative beliefs or attitudes towards others, and it most oftentimes creates inequality or disparity in access to services. And so I think it's really important that we talk about the term stigma and work to break down the barriers so that we can have open conversations around opioids, around the risk of opioids, around the appropriate use of opioids, and how somebody can ask for help when they need it, so that we can provide and look at increasing the amount of services and resources available to our community. So I will go ahead and open this up, and my hope is that
we are in Northern California, and it is beautiful here, and we have dealt with the same thing that everyone else is dealing with: racism, health inequities. Homelessness is high, people are out of jobs, and substance abuse is really affecting our entire community.
Studies have shown that approximately 60% of addiction is genetic predisposition. So there are many triggering factors that can lead to addiction. People suffer from depression, or simply people suffer from other psychiatric disorder, put them at higher risk for addiction. Prescribed opioid medication is another gateway, and of course environment can also be a factor.
Isolation it's a big part of addiction here. This community is a lot of us are like spread out, and they use alcohol and other drugs to cope.
I became addicted to opioids after having spinal surgery, and I started taking medication as a result for the pain, and was addicted to them in total for a year and a half. I thought stopping the drugs would be easy once I decided I was going to, and I was having physical reactions that I could see and feel when I wasn't getting the drugs. So it was harder than I thought.
By the time I was 12 or 13, I was smoking meth with my mom, and I was using every day after that. and it was really hard to imagine having a day without being high. And I went through several different foster homes my last year and a half of high school, and the last home I was in were foster parents who were a little bit hippie, a little bit rock and roll, and without their unflinching love, especially in the light of my most awful behavior, I honestly think that I may have killed myself, either accidentally or otherwise. My life today is such an incredible miracle, and it is never lost on me. I'm in my 27th year of recovery, and there are still some days where I stand at my kitchen window and I look outside my backyard and I'm struck with disbelief that I live in a safe home with my sons who are safe, who have everything they need, who have never seen me loaded. My life is incredible.
Many people experiencing addiction do not seek help because they feel shame about their addiction, and they're concerned about being judged by their friends and their family or the general community. So it really, stigma surrounding addiction and it being their fault prevents them from getting the help that they need.
Oftentimes, stigma becomes a barrier. So if we want to see a successful outcome, we have to start from there. Our role here in our community is really to educate everybody more about what is addiction. We need to let people know that the earlier that we can start the intervention, the better outcome that we are going to see.
Freshman year, high school, I got caught smoking marijuana on campus by like our favorite teacher, so that was pretty shameful. I got expelled from the school, so I went into depression. I got back into school, played sports, but I still drank, I still smoked, and then I think eventually I used meth. One night at Overdose, that really took me really by surprise. It really woke me up to realize that I could have lost my life, and it really helped me realize that I need to stop abusing myself. My body, my spirit was telling me that I have a bigger purpose to serve. To be able to recover here in my own community at home was the best thing, because it really opened my eyes to what the true meaning of being a community member, being a family member, being a friend, being a husband really means. The life that I live today is amazing. I'm thankful to be able to experience fatherhood, be able to experience being married for almost 12 years. My mind and my heart is open. I feel connected. Through recovery, that's possible.
If you're a loved one of somebody who's struggling with addiction, I think one of the first steps to do is reach out. Let that person know that they're loved and cared for, and let them know that you're not going to judge them for the choices they've made in their path.
When someone is ready to ask for help, there are definitely resources in our area. And with Mendonoma Health Alliance, we can help you get connected to those services. It can be online, it can be in person. We're here to help.
If you're a person experiencing addiction, I want you to know that you're not alone. Mendonoma Health Alliance is more than ready to help you find the resources to jump those obstacles that are in front of you.
Addiction is not a choice, and it doesn't define people.
Como hablamos de las personas que usan drogas, importa.
I am not my addiction.
We can overcome addiction
Together.
A wonderful video.
Jordan, come over here. Come over here. This is freaking crazy. You see?
So I think that was a great introduction to talking more about stigma and really how we can decrease the barriers, open up the lines of communication, reduce the judgment that others feel, and hopefully work on improving access to services in our community. So I'll move on ahead to opioids. There are a few different terms that I'd just like to cover as definitions. And so we have really three different types, and there's natural, semi-synthetic, and synthetic opioids. The term opiates and opioids are sometimes used interchangeably. Opiates are really the raw opium or derivatives of opium, which are naturally occurring from the opium poppy. And when we talk about natural opioids, those are really morphine and codeine. So they're extracted and there's really no chemical modification. They are used to manufacture the medications, morphine and codeine. Then you have the semi-synthetic medications, which are created from the natural occurring morphine and codeine. However, they have some sort of modification with their chemical structure, and they are used to create the products oxycodone, hydrocodone, hydromorphone, and oxymorphone. Heroin is an example of a process. It's processed from morphine and extracted from certain poppy plants, and it's chemically modified through a process, which makes it into heroin. And then you have synthetic opioids, which are made in laboratories, and they are designed to have a chemical structure just like opioids. So your body sees them, and they look just like opioids, they act just like opioids, but they're not from a natural occurring opioid. And so those are the fentanyl, the methadone, and the tramadol. And I just wanted to note that methadone is a synthetic opioid, and it is used to treat pain, more chronic types of pain longer term, but it can also be provided through opioid treatment programs to treat opioid use disorders. Fentanyl is the one that we are seeing a huge increase, and a huge increase specifically contributing to opioid overdose because it's being manufactured, it's being cut into or used to lace methamphetamine, cocaine. It's being put into counterfeit pills, which look just like prescription pills, but they're actually laced with fentanyl, and so it's a huge risk. This next slide covers a few different prescription opioid names, and then also some of the street or the slang names, which I won't cover all of them, but I think it's just kind of a good overview to broach the topic. So if you hear some of these different terms, and some of these terms are also regional, so the terms that may be used in one region may not be used in another region. So for example, fentanyl. The brand name is Sublamaze or Actique, and it's got a variety of other names, including Dance Fever, Jackpot, TNT, to name a few. Hydrocodone. Hydrocodone is a common prescription medication that's oftentimes used for an acute type pain, for example, after a surgery. But when it's used in another context, it may be referred to as bananas, hydros, Vikes, V, vitamin, 387s, 357s. Hydromorphone is Dilaudid. Dilaudid is the brand name. And this one is D, Dillies, Footballs, Juice, Smack. You've got oxycodone. Within oxycodone, we've got Oxycontin, which is the extended release version. And you've also got more immediate release versions like the Percocets or oxycodone immediate release. And so, these may be the oxys, the ozones, the roxys, the berries, the blues. Sometimes people refer to them based on their numbers that are imprinted on the tablets, to the colors, which specify different brands and things like that. And I think I do see some things coming in through the chat, but I unfortunately cannot see them right now. So I will take questions at the end.
I'll monitor that for you, Emily. No questions.
Okay. Okay. And then morphine, so Durmorph or MS Cotton. So again, MS Cotton is the sustained release version. So you've got monkeys, the Morphos, the white stuff, the Miss Emmas. Methadone can be Dollies or Dolls, Fizzies, Red Rock, Tootsie Roll. Then you have heroin, Black Tar, Black Pearl, even, I see White Lady, White Horse. So there's a whole variety of different terms. And like I mentioned, some of them can be regional. Some of them are specific to maybe a person's, a specific brand that they have. So it's just important, I think, that we understand more that opioids can carry a variety of names. They can carry their prescription opioid name, whether it be generic or brand name, but then they also have a lot of other names that they can sometimes be referred as. Next, I'll talk a little bit about how opioids affect the brain, so how they actually work in the brain. So our normal brain is kind of pictured there on the left-hand side. And opioids are, we have opioid receptors throughout our bodies, throughout our brain, and we have natural occurring endorphins, which our body makes. Our body makes these, and they actually attach to these little, what we call opioid receptors. And so the blue is the endorphin. That's what your body naturally makes to help, if you are in pain, our body actually makes things that help us with the sensation of pain. And it normally stimulates our dopamine reward system to help us feel better. When opioids come into the picture, you can see the opioids are in red. And so when you have opioids in your system, they also attach to these receptors. And over time, and even when used acutely or for a short-term period, they can cause excessive stimulation of the dopamine reward system, which can over time sometimes can make individuals become more dependent on them because they may be seeking out that feeling of reward and pleasure within the system, which is based on that excessive dopamine production. When used appropriately, opioids, like I mentioned before, they're an important treatment for pain. However, some of the unintended side effects, which are the sensation of pleasure or happiness that one may feel when taking them, is actually a side effect. It's not one of the desired outcomes, but this can result in, over time, individuals may end up seeking that type of a feeling from taking the opioids. So some of the common side effects of opioids are an upset stomach or potentially throwing up, dizziness, euphoria, which is just that sensation of pleasure or happiness. It can also cause dry mouth and constipation. And those are common. All medications have side effects and that we have to be aware of and look out for. Some of the more serious side effects of opioids are slow or shallow breathing, trouble breathing, confusion, vision changes, loss of consciousness or passing out. And those are the more serious side effects that we worry about that can occur, for example, in somebody who hasn't taken opioids before and who may be taking them as prescribed and has some of the more serious side effects, such as slow or shallow breathing or confusion or vision changes. And so you can imagine if somebody who hasn't taken opioids before forgets that they already took their medication and they take another dose, it can make these serious side effects even potentially worse. And so it's really the serious side effects that we become concerned about when we think about opioid overdose. Over time, individuals who are slowly increasing their dose due to dependence, whether intended or not intended, oftentimes it's not intended. I know individuals, personally, who have struggled with becoming dependent after surgery and having to, take opioids for a prescribed purpose. And as they've, been on it longer term, their doses increased in order to have the same level of pain relief. And so oftentimes it's unintended. But as you increase that dose, you also increase the risk of some of those serious side effects. So doses that were once sufficient to relieve your pain are now not relieving the pain. And as you increase that dose of opioids, there's an increased risk for those serious side effects, especially in individuals who haven't used opioids before. So some of the signs of an opioid overdose that are really important to look out for are, the dizziness, the confusion that I talked a little bit about with the serious side effects, the slowed or shallow breathing. So if you notice that their breathing is much slower or their breathing is, stopping intermittently, so they're kind of taking a breath and then they're not taking a breath and, they take another breath, if they have slurred speech, if they become unconscious, or if they can't be woken up. So if they can't be woken up and you give them, we call it a sternal rub. So you kind of rub your hand on their chest and they're not arousable, or if you kind of just kick their foot a little bit to try to arouse them, and they're completely non-arousable, not woken up, that's a potential sign that somebody could be overdosing. A choking or gurgling or snoring sound, really just the drowsiness, difficulty staying awake. So if you notice somebody is just kind of nodding off, and then you arouse them and they kind of arouse a little bit and then they start dozing off again. Blue lips or nails, that's definitely a sign of potential opioid overdose. Clammy skin. So as you start seeing these signs, and if somebody is becoming not arousable or their lips are turning blue, these are really signs that their carbon dioxide levels are increasing and their oxygen levels could be decreasing. And these are all signs of a potential opioid overdose that we want to look out for. We, again, have to recognize that, that fentanyl is being added to a lot of other illicit substances, including methamphetamine, cocaine. It's being put into counterfeit pills. So even though you may not think that somebody is, overdosing because of the substance they were using, it still is quite possible, and that's where we've seen a large increase in opioid-related overdose deaths, is because fentanyl is being used so much more broadly. So if ever in doubt, it's best to treat as if it's an opioid overdose. And emergency response is really, really critical. So I always say time and response are really the difference between life and death. Delaying treatment, you're like, oh, I don't know, are they overdosing? Are they not overdosing? I can't arouse them. They have some of the signs. It is definitely best to definitely call 911 and treat as if it was an opioid overdose using the intranasal Narcan. So first step is call 911. Emergency response is critical, and the use of the intranasal Narcan is not going to, it may not be sufficient to fully take care of the opioid overdose. The intranasal Narcan only lasts so long, and so you really want to call 911, use the intranasal Narcan, and then stay with the person. And so after you've used the intranasal Narcan, you want to put the individual in what we call a recovery position, which is really their hand supports their head, they're laying on their side, and their knee stops their body from rolling onto their stomach. So you can see the little diagram here. So they're on their side, and that way, should they start vomiting, they can clear their airways. You want to monitor for at least 5 minutes. And Narcan works fairly quickly. So you should start to see a response in how the Narcan is reversing the opioid overdose. If you still don't see a response, you can give a second dose and continue to stay with the patient, with the individual, and monitor them. I did want to bring up California's AB 1535 and the 911 Good Samaritan law, which both support the expanded access to naloxone and encourages people to call for emergency assistance at the scene of an overdose without fearing arrest or prosecution. Because opioid overdose has become, so much more prominent in our communities and nationally, this law was put into California to help provide protections, because it's much better to treat somebody who may be overdosing from an opioid than to not call 911 and not treat them because you have fear of arrest or prosecution. So call 911, administer naloxone Narcan as soon as possible, and stay with the person until help arrives. And we'll go into a little bit more about the intranasal Narcan in just a few minutes, but I'm going to pause, and we have our first poll that's going to be coming up.
All right, just give me one moment. Okay, so everybody should see a poll that has 4 questions. So go ahead and answer those questions and we'll give people just a minute here. There are no, there are right or wrong answers, but just do your best. This is really just our way of seeing if the concepts are coming through to our viewers. Looks like we have some responses in. Give another 10 to 15 seconds. Again, no worries if you, oh, got more coming in. No more worries if you don't know the answer, just give your best guess. Okay, perfect. So I'm going to end the poll now. Thank you for that.
Great. I can go ahead and close this right initially. Okay, so remember that emergency response is critical. Time and response are the difference between life and death. We want to call 911. We want to use Narcan or Naloxone intranasal spray, and we want to make sure that we put the individual in a recovery position and stay with them. We don't want to leave them. So what is Narcan or Naloxone? Narcan is the brand name and Naloxone is the generic name. So they are used interchangeably. They are the same medication. They're the same drug. Narcan is used to rapidly reverse the effects of an overdose from opioid drugs, only opioids. So it's not going to work for benzodiazepines or other drugs. It's specific to opioids. Naloxone is available as an injectable or an intranasal spray. And for the context of today's conversation, we're going to be talking specifically about the intranasal spray. The injectable is usually reserved more so for like emergency response teams. And Narcan naloxone is what is more broadly available in the communities. And naloxone saves lives. This is a life-saving modality. And it's critically important that we understand how to use it and how, so we can teach others how to use it as well, potentially. It's important to understand that, especially if somebody has it in their possession, if they're at the point of potentially overdosing, it's not going to do them personally much good unless somebody around them knows how to help them. So it's one thing for somebody to have it, but it's another thing for our friends, for our family members, for others in our community to also know how to use it. And that way, should you come across somebody who may have it with them in their possession, you can help them. So let's talk about how Narcan nasal spray works. So you can see here these green little squiggly marks are those opioid receptors that we talked a little bit about, where normally the opioids attach to. And that's where they attach to that little receptor. And that's where if we have too much in our system, then we start having the effects of the respiratory depression, difficulty breathing, difficulty staying awake. And that's where we have the potential for death. Narcan or naloxone are these green ones, and they are able to attach to these more strongly than the opioid is. So when intranasal Narcan is given, it actually bumps the pink opioids out of that spot and sits there instead. And in doing so, it knocks the opioid off and it allows the person to then again breathe, which is the most important element, and reverse the overdose. it can keep these opioid off this spot for about 30 to 90 minutes, which is not a very long time. That is why it is so critically important that you call 911 right away and that you be prepared to administer a second dose if you don't see any response. The naloxone for very strong opioids or for somebody that has consumed a large amount of opioids, it can take more naloxone to reverse the effects of that overdose. And so most often, somebody will have to be monitored for several hours, even after their last dose of naloxone, to make sure that all of the opioid has been cleared from the body and that there's no risk of them going back into an overdose. Okay, so I think we are going to go into our second poll.
Okay, wait, sorry, just one second. I'm trying to get our second poll up. Okay, there we go. And this one is only 3 questions. Have almost all the answers. We'll just wait a couple more. Oh, there we go. Okay, I'm going to end the poll now. Thank you.
So this next slide shows the key steps to administering Narcan nasal spray. And I'll just go over it briefly, and then I have a short video that shows kind of a more live rendition. So it comes as the little package, and it comes 2 in each box. So you want to just peel back the package to remove the small device. You hold the device with your thumb at the bottom of the red plunger and 2 fingers on the nozzle. You place and hold the tip of the nozzle in one of the nostrils, and you want to insert it fairly high up into the nostril so it makes a good seal. You don't want it to come dribbling back out, so you want a pretty good seal up there. And then you press the red plunger firmly and release the dose into the person's nose. So I'm going to bring up this brief training video since I think that it does a good job. Briefly.
Hi, I'm Allison, a pharmacist, and today I'd like to go over how to use your naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So you've called 911 and grabbed your naloxone. Now what? This is Narcan nasal spray. It comes in a box with 2 doses. You're going to take 1 dose out of the box, remove it from the packaging, and the applicator goes in 1 nostril, and you're going to depress the plunger with a quick, firm push. When putting in the applicator, you'll want to form a tight seal at the patient's nose so that the medication goes up into the sinuses and does not come down the face. And then with a quick, firm push, you're going to administer the medication. There's no need to depress the other nostril. You can leave it open. And if a second dose is needed, you will apply it in the other nostril than the one that the first dose was given in. And that's how you use the Narcan nasal spray.
Okay, so again, you want to peel back.
If you know someone who takes prescription opioids like Percocet or Oxycontin.
You want to peel it back. You want to take that nasal spray, insert it into the nose, depress the plunger, wait about 3 to 5 minutes, see if you have a response. If the person starts breathing again or becomes more arousable, that's a sign that the Narcan is working. And then you always want to make sure you put them back in recovery position as you wait for the effects to kick in. One of the common questions that comes up is, does Narcan hurt if somebody is overdosing? It does not hurt. If somebody is overdosing, they need the Narcan. Without that Narcan, the chances of death from that overdose are very risky and very high. So on the flip side, if somebody is really not overdosing from an opioid and you administer Narcan, if somebody doesn't have any opioids in their system, there's no harm. It doesn't do anything if you don't have opioids in your system, and it doesn't cause any side effects or harm to an individual if they are not overdosing. So as we kind of come to a conclusion of the presentation today, I wanted to circle back to the why here and why now question. My hopes is that I've provided an opportunity for each of you to learn something new today about opioids, about the reversal medication, Narcan or Naloxone, and that you feel more confident in how you too can save a life if you identify somebody who may be overdosing from an opioid, or just being more aware of what the potential signs of an overdose are and how to respond. Opioids are abundant in our communities, and it's so important that we all educate ourselves so we can educate others and take care of each other as we work to overcome really this opioid epidemic. It's critically important that we eliminate the stigma associated with opioids and also with Naloxone. I can't tell you how many patients I've encountered who had a prescription for Naloxone written because they were prescribed an opioid medication for a short-term basis. We usually use it, as a just in case, because like I said, somebody can very easily accidentally overdose as well. And I can't tell you how many patients I've had that said, I'm not getting the Naloxone, I'm not an addict. I don't need that. I don't have a problem. I'm not going to overdose. And I think we really need to change that. We need to change the way that we talk about it. We need to make sure that people know that it's just in case and it can happen to anybody. How to recognize the signs of an opioid overdose quickly, and how to really request emergency assistance and administer intranasal Narcan. So remember, call 911, administer the intranasal Naloxone, and stay with the person. I also ask that you educate those around you, because the more people that we educate and the more resources that we share, the more lives that together we can save. So I have a few self-assessment questions that will give you an opportunity to kind of practice what you learned. They're really just for us to go over together. So the first one are, what are some examples of opioids? So we talked about the morphine, codeine, hydromorphone, oxycodone, hydrocodone, methadone, codeine, and fentanyl are your main your opioids. And then you also have heroin. What does stigma mean? So we talked a lot about stigma, and these are kind of the key characteristics of the definition of stigma. But we also talked a lot about how it creates inequality and negative beliefs and attitudes towards others, and the importance of reducing the stigma associated with opioids. What are the signs of an opioid overdose? Blue lips or nails, the dizziness, the confusion. You try to, arouse somebody, you shake them, and they're just not waking up. They have slowed or kind of gurgling breathing or deep snoring sounds. The drowsiness, difficulty staying awake, those are all really critical signs that somebody could be in trouble. And again, once we have these signs of an overdose, it also means that the levels of oxygen are declining or decreasing in your body, and that is ultimately what puts us at a very high risk of brain injury and death. How can you respond to an opioid overdose? So remember, the emergency response is critical, and the time and the response, the actions that we take, are really the difference between life and death. Call 911, administer intranasal Narcan, put the patient in recovery, and stay with them so that if you need to administer a second dose, you can, and you'll continue to monitor them. These steps to administer intranasal Narcan is easy. You open the package, you place it in the person's nose firmly, and then you just depress the plunger. And lastly, why is it important to anonymously report the use of naloxone? So reporting the use of naloxone in our community helps us to identify what communities may need resources and support. It also helps us to track if the naloxone that is being distributed in our community is being used. And it may also help with funding additional services and resources in our community, including emergency response. I think now we have our final poll.
All right, so that was just launched. We'll give everybody a minute or two. And if there's anybody on number 6 who'd like to be added to our email listserv, please just send me a private message in the chat box. You can select who you send the message to. My name is Micheline, and I can collect that from our chat and make sure you're added to future class presentations. And we provide information on a variety of different health education.
Okay, and lastly, as we wrap up, I really appreciate, again, you having me today, and for those who were able to join, really appreciate you joining and, being open to learn more about this topic. And I'd like to open up to any questions.
Great, yeah, so we do have, one question. Do semi-synthetic and synthetic opioids bind more tightly to the receptors? Do they create increased stimulation of receptors?
Great question. So they do not. So there are some opioids that tend to be more potent or stronger. But generally speaking, opioids bind with the same strength to that opioid receptor. It really has to do with the amount in one's system. So if you can imagine, if you have 100 different opioid receptors in an area, and there's a specific amount of opioid in your system, and some of them attach to those receptors, and some of those receptors don't have anything on them, then there's not as high of a risk. But when you start having a lot of opioid in your system, or if the potency, so I will say that the potency of fentanyl can be very high in relation to some of the other opioids. And so when you have a higher potency, which means a concentration is much higher, there's just more of it. It takes less fentanyl to cause the same effect than it does if you were to use, for example, like codeine. So it's not that they attach more strongly to that receptor, it's just that they are what we call more potent. So they're stronger opioids. If that makes sense.
And just quickly, I want to let everybody know that we do have free Narcan available at Mendonoma Health Alliance. So it's available to anybody today who's completed the training. All you have to do is email us or call our office, and we can either mail it to you since you've already completed the training, or you can swing by our office and pick it up. I'm putting in the chat how people can get a hold of us. There are a few different ways. Our general email is info@mendanomahealth.org. And then our phone number is 707-412-3176. And you can dial extension 102. But just put our email address in the chat, and our phone number is next. And the last thing I just want to mention is that we do collect data on opioid overdose reversal. So Emily had mentioned why it's so important. And we encourage people to report the opioid reversals that they either administer themselves or if it's been administered to them. And it's anonymous. So we just collect very basic information, and people can give as much or as little of that as they'd like to us. But what we generally ask is gender, zip code, and how many doses were administered, and the general age of the person. So you could say in the 20s or 30s or 40s. And of course, if an overdose does occur using Narcan and people don't want to be very specific about who it was given to for confidentiality, you can easily also just call and say there was an overdose reversal in Gualala last night. If that's all you want to give. But we do encourage everybody to do that because it helps us understand what's happening in our communities so that we can take steps to either increase services or take different directions. So.
Okay, if there are no other questions, please feel free to reach out if you think of anything after the presentation.
All right, thank you, everybody. I am going to, before we log off here, just copy and paste everybody's emails. And outside of that, appreciate you being here. Have a great day, everybody.